My name's Kathryn. I went to Cheltenham Secondary, so it's a school in the southeast suburbs. It's a public school. I did a PhD in neuroscience, so looked at certain cells in the brain and how that regulates things like female reproduction. I just kept picking subjects that I enjoyed, so I started with science, and as I said, it starts really broad, and then kept picking the subjects that I really enjoyed and had some contacts in that area and went along with that. So interesting, it's so complex and can explain so many different things about the way the body moves and how the body works. Okay, so I look at diseases in population, so diabetes, cardiovascular disease and things like obesity, and how different prevention strategies might affect different population groups differently, especially more disadvantaged populations. We've looked at quite a number of policies in Australia and how they might affect disadvantaged communities, and a lot of that's made media. So last week my research was on the news and in the radio, on Triple J. So it's made a lot of media, which has been good. It's just so interesting, it's so different day in, day out. Some days I might spend in front of the computer reading and writing about things I'm interested in. Other days I'll sit down with students and I'm sort of a mentor and supervisor with them. Other days I'll spend time communicating with places like the Department of Health or with people from all sorts of different backgrounds. I think just follow your interests. It's such a broad area, and I think just follow your interests. And then when you go to eventually when you get a job, you go to work, and you'll never really be working a day in your life because you'll just be studying and researching and working in an area that you really love and enjoy. There's a lot of very good things about my job. I think the best thing is discovering new things for the first time ever and hoping that those things will make a difference to population health. But there are a lot of really great things about my job. There's a lot of travel involved. So in the last 2 years, I've travelled to places like Sweden, to the Netherlands, to all over Australia. So there's lots of travel, it's diverse. Every day you come in, you do different things. But I think at the end of the day, the best thing about my job is just hopefully making some kind of difference to population health in Australia. I think the best advice I've ever received is just follow your dreams and follow what you're interested in. And if you do that, you're always going to do something you enjoy, and you're always going to go to work enjoying what you do.